¿Quién está más grave? He's like, Joe, let's make it real simple for you. Who is the worst one here right now? Because that's what we're going to do. Naturally, that is what he wants to do, is go after who is the worst. So that wasn't that hard to figure out, because Russ, Vietnam vet, was over there in a full-blown war zone, He's over there vomiting and yelling and moaning and groaning, and it was just, you don't even want to get near it. And Ricardo's like, okay, let's go. So then we walk over there to Russ. Russ is going through his process. And so then here's something, what is the role of the shamanic healing and all the rest of these other healing traditions, all these medicines, is that, and he's been through the cognitive therapy and probably some exposure therapy and all these different things. But there's something to be said, the shamanic world is bringing to the discussion about, accumulated energies. Like, how do we deal with that? Whether it's emotional stuff or whatever we want to call it, spiritual stuff. How do we deal with accumulated energies that are knocking around inside us from our childhood or from some traumatic experience, and we've thought our way out of it, but we still haven't got our way out of it. And the feeling is still there, and we're still stuck, and we can't get past it. And so then, for Ricardo to say, okay, well, this, we need to clean out his darkness and the trauma. So he's going to do that. So Russ, with just the ayahuasca and the whole setting and the diet and all the rest of it, and the beginning of the ceremony, he's seeing himself, and he's seeing dark black leeches just bubbling to the surface of his skin and just kind of oozing, like this deep darkness is just oozing out of him all over the place, And then Jared is sitting next to him. I don't know, Jared, you have a doctor's perspective. And so what do? You look for, do they have asthma or some kind of allergen, or do they have reflux, or you do all the basics that maybe primary care will do for a while. And then you look into, send them to the pulmonologist, So the lady has had CAT scans and pulmonary function testing, and she's a lady of means. She's had everything worked up extensively and continues to have this frustrating cough that nobody really has an answer for her to deal with this problem. So she arrives to Niuerao, so we can move forward. So she has to fly into Lima, just so you can imagine coming there. You fly to Lima, you catch another plane to Iquitos, and then we pick you up in Iquitos in one of those modal taxis, and you drive like an hour and a half. You cruise past Yangchama and then the Nai River, and then you keep going, and you enter the village. You enter Niuerao, the spiritual center, where we say it's Shipibo Niuerao for the name, and Centro Espiritual in Spanish for the mestizo culture that houses the Shipibo culture, and then we struggle to be integrative, with us all working together. Next slide. This is, maybe you come in, you have a tea. In her case, she's coming for one night, okay? We would prefer that people come for 1 week or 2 weeks or 10 days. Other people are staying for 1 month. People are staying for 3 months. People who are in long training are staying for 6 months, and we have people staying for 1 year. But, a complete, at least, assessment and diagnosis and some treatment would happen over a period of at least like 1 week, 3 ceremonies. But there are situations where somebody can't come for more, and so she's a friend through friends, so we said, okay, bring her in. So she comes, this is our kitchen. She walks by, gets to know the Niuerao, the master plan, and eventually has to take her vomitive, on a rush job. If you're coming for one night, we don't want to always make people take the vomitive, but she wanted to do it, to go all the way. So then the next step in your arrival to Niuerao, when you come and you get settled into your room and all that stuff, eventually we have to go to the Maloca, and we have to talk to Ricardo and myself and other people about your case and what's wrong with you and why did you come. So, I talked about her history, her medical history, and then, one of the weird things about her case is she's part of a team of people that brings people to Peru to do cleft lip palate surgeries, plastic surgeons, and they do this free service for the poor people of Peru. So we were, trying to help her out. For one, she's doing a great service for poor people, and that's who works for us. And number two, he brings people to Peru that might come to our center, so we want to show her a good experience. And so one of her colleagues came to our center first, wrote a nice article, I don't have it on my computer somewhere, about her experience, had a major experience at our center. And actually, during her ceremony, saw this woman, Kim, who says I can use her name, sitting next to her, you know, right next to her in the maloka. She's not there, she was in the United States or whatever, but she saw her sitting there next to her so clearly that inspired her to tell her, you have to go there. This is where you need to go. That's why she came to our place. So, and again, educated woman with a big, you know, corporate success history behind her, decides to finally make a break from the corporate world to get involved in this nonprofit work, which she's very inspired and passionate about and happy about. And she's been through her whole workup and talks to Ricardo. I don't think Ricardo was there at that time. I had to talk to her and for a while. And so then, you know, I'm asking her about her history and what's the deal. And then she says, well, you know, actually she went to a seer, some kind of spiritual healer in the United States that told her, you know, this thing you have, this cough, this isn't, the doctors are not going to help you with this. You know, this is like a spiritual wound that you need to be helped with. And so then as you get into her history more and talk to her more, she's like, you know, that cough, it doesn't come from here, I feel it from here. You know, and if you talk to her colleagues, the same woman, that her friend that invited her, she's like, oh yeah, she's coughing all night, you know. She's like, yeah, this cough is coming from here. And so it's like, okay, it's some kind of thing here. And so then you talk to her more and like, well, what's your story, you know? And then she talks about her childhood and, you know, her just alcoholic parents that weren't really there, and she has to raise the other siblings, and she didn't really have that love and support, you know, at the beginning, and then ends up meeting a guy who she falls in love with and thinks everything's great and is very happy and is in this committed, loyal relationship for 20-something years. And then just recently, in the last year, found out that he's been cheating on her like the whole time, big time, and she was totally blind to it and the deceit, and she's so devastated because she was always trying to do the right thing and thought everything was fine. But there was this big dissonance in her life, you know? There's this big dissonance of like, you know, why didn't you notice? How could you not notice? An openness here. Nice touch. So that was her situation, you know? And so then in the Shipibo way, you know, there's, in Spanish, we say, you know, pena, una pena. So pena is like grief or shame, you know, it's a combination of those things. And then for them, sometimes the pena is here, you know, it gets stored here in, like, you know, people's preoccupations and their ulcers and all that kind of stuff. So then I go and I take her over to, it happened to be Julian and Olivia, and I tell them, hey, this is this lady, she only has one night, and she's doing this great service in Peru, and she brings these other people, and she has this pena right here. We need to help her, you know. So Julian's listening, and Olivia doesn't speak that much Spanish, but she's listening. She understands most of it. Julian tells her, and I say, I'm like, Olivia, you know, come on, please. So then we go into the ceremony. So it's another ceremony. Her intention is to heal this spiritual wound as she understands it, and the hope that it will help her cough. And so we go back to the maloka. And so it's back to this thing, you know, when you go into the ceremony with us, this is a regular thing we talk about all the time, you know, you don't drink ayahuasca, you do it to do a work. You need to have a work in mind. You need to have, why are you doing this, your intention, every ceremony. So that's going to be your mantra, you know, when things get difficult, you're going to go back to that. So hers was this, to heal. This is our maloka niweral, that's the ceremonial hut where we do the ceremony. So the ceremony begins, we're there in the darkness once again, you know, as I talk to you guys, the lights are out, the power is out, the animals are buzzing outside, and the birds and the frogs. Go back one time. So then, you know, for us, back to this like very simple concepts that Ricardo will just, he has a very simple approach generally, and it's all about him. It's just like, well, we just have to connect them, get the medicine, then we got to clean them out, you know, limpiar. Then we're going to center them, and then we're going to open them up. Like, so you just tell them, you know, they tell you this long story. It's like, okay, limpiar, centrar, you know, it's like, okay, we're going to go back to that again. So we continue. So stage one, you know, we always try to prep people for the ceremony, like what is the stages of the ayahuasca experience, you know, it's not a textbook, but these are just ideas, concepts for people to work with. But the first step of the ayahuasca as it comes on, you start feeling it in your body, is that very often people see, you know, psychedelic designs, and most commonly with us, it's the, you know, people do regularly see the Shipibo designs, you know, in our center. That, oh, that's what I saw. You know, I saw just like this. This is what I saw. You know, all the time, every day. So then he's like, oh yeah, that's the beginning. You know, that's when you know the medicine is coming and the medicine is there. And so then at this stage, you know, we drink ayahuasca. So I would say, okay, Kim's only here one night. We underdose everybody. You know, we don't want anyone overdosing. We want people to be able to work with the medicine. We don't try to blast anybody out. You know, you can traumatize people that way. So we gave her a little bit. You know, she doesn't have any experience. So I said, oh, don't worry, Kim. I'll go like in an hour. I'll go check on you. So I go over to Kim. You know, Kim, how are you doing? And she's like, you know, I don't know. I'm not sure I feel anything. I don't know. It's like, okay, Kim, come on. Let's drink some more ayahuasca. You know, it's your only night. Come on. So I'll go and kind of top her off. And send her back to her place, and then go, and then the ceremony's getting going. You know, now the songs are going. So stage 2. Oh, no, the symptoms of ayahuasca. So then we always have to tell everybody. He prepares everybody, and it's, you know, it's not like you're going to throw up every time. And people aren't always throwing up, but sometimes, yes, you do throw up from ayahuasca. It's not uncommon. So the symptoms of ayahuasca. So we have to prepare people. You know, like, okay, this is what might happen to you tonight. So you don't freak out. You're not dying. You haven't been poisoned. You know, you might get nauseous, you might throw up, you might have diarrhea, you might have, your temperature might lose control, you might have fever and chills, you might be burning up or freezing, you might have pain, you know, in your body, in your stomach, in your head, in your back. You know, maybe you have an area of your body that, as we would say, the ayahuasca is working on. And so you have pain, and sometimes that pain is very strong. So don't worry when that happens to you, everything's okay, you know, not typical. You have the bucket. So then, yeah, the second stage. You know, you've gone through a little bit of psychedelia, you've gone through some symptoms, and now the second stage is kind of the self-awareness. You know, things start opening up. Maybe you start reviewing some things. Maybe you're shown some things about your life. Maybe you notice something dark. Maybe you remember something dark. Maybe you relive something. And so this is where things can get a little cloudy, a little difficult. You know. That may be not happening, this may not happen to you, but maybe you get into a state where you may get a little scared or something like that. And so this is where you need to have your intention. So this is where she's going to start initiating a dialogue, and then we're into this other very strange concept that is commonly experienced at the center every day and all throughout the whole Iquitos experience, is dialoguing with the ayahuasca. You know, I don't want to see that. Show me this. You know, please help me. Please turn it down. You know, please do this. And getting a response. And so that's what you use your intention for, is like, you know, I want to heal this thing, you know. So when we train people, this is the people centered. Tell the ayahuasca, you know, when you're having a hard time, heal this thing. Please help me heal my cough, heal this wound. Just go back to that as a mantra, Go over. It doesn't matter what's happening. You know, who cares what's happening? This person's screaming, or Russ is throwing up, or whatever. Stick to what you're doing. Why are you here? You have one night. This is the Amazon. You came all this way. You know, push for your healing.
Matevo que trae tamite makaya ka akana